Today, I want to talk about a common but often misunderstood source of hip and glute pain, more frequently in women. If you've been dealing with chronic nagging discomfort around your hip or lower back that comes and goes, this video is for you. Hey y'all, my name is Dr. Korey Rose. Let's break down why this happens and what you can do to fix it. First, let's talk about why women are more susceptible to this condition. There are two main reasons: anatomy and hormonal factors. Women naturally have a wider pelvis compared to men, which changes the angle of the sacroiliac joint or the SI joint, and it also alters the hip biomechanics. Over time, certain sleeping positions, especially sleeping on your side without proper support to your thighs, can overstretch key muscles like the glute medius. The sustained hip adduction overnight cumulatively over long time develops muscle memory or neuroplasticity for a lengthened glute medius and minimus on the involved side. The glute medius is the primary hip stabilizer, which means it supports the hip to the pelvis and is commonly referred to as the rotator cuff of the hip. And when you have an unstable glute only on one side, the biomechanics of that hip are changed, putting in extensive tensile and compressive loads on the glute medius tendon, which causes irritation, pain, and even long-term dysfunction. It is suspected that there is a hormonal component for postmenopausal women as a potential source or contributing factor of this condition. I personally believe it's more of a contributing factor and not the main problem. The reason I think this is because the majority of the cases present only on one side or unilateral, which by the way almost always correlates with their sleeping position. If hormones were the larger culprit, then the symptoms would be bilateral in most cases or prevalent in other tendons throughout the body. At the condition's earliest onset, it is classified as tendinitis, which simply just means an inflamed tendon. Now here's the tricky part. Most people don't seek treatment when they're in the acute tendinitis stage because the pain is often mild and it'll go away when the patient changes their positions. But if left untreated for about 6 months or more, this condition will likely evolve into tendinosis, aka tendinopathy. Continued chronic untreated tendinitis creates an ischemic environment in the tendon, which means a lack of blood flow, causing cell death and developing strips of dead necrotic tissue within the tendon. We now have arrived to tendinosis. This is where a lot of people, and most healthcare providers for that matter, get it wrong. For tendinitis, an anti-inflammatory, non-steroidal or steroidal approach is the right way to go. That means rest, ice, and reducing activities that trigger the irritation or inflammation of the tendon. But for tendinosis, you actually need to stimulate inflammation within reason. We still want to reduce the high-intensity activities that put a compressive or tensile load on the tissue to promote healing. That's because tendinosis isn't about active inflammation, it's about a lack of it. The use of steroids on tendinosis should be strongly discouraged, as steroids can create further ischemia, potentially giving short-term relief but further progression of the tendinosis. Gluteal tendinopathy is often misdiagnosed as bursitis, particularly trochanteric bursitis, because they share similar symptoms in a very similar region of the lateral hip. And the standard of care for bursitis is steroid injections. However, a simple exam and some palpation of the patient would quickly reveal that we are dealing with something much different. Now, glute tendinopathy and bursitis are frequent comorbidities, which mean they happen frequently together or at the same time. Glute tendinopathy can manifest referred pain as well, which strongly mimics sciatica, causing very frequently a misdiagnosis of sciatica when indeed the patient is experiencing the referred pain of glute tendinopathy. The path of the referred pain is posterolateral aspect of the femur, when sciatica is purely in the middle of the posterior femur. This frequent misdiagnosis leads to frequent mistreatment and continued unaddressed tendinosis, which continues to necrose. First and foremost, we have to correct the improper support at night by utilizing a knee pillow to remove the compressive load off of the tendon. We have had great results in our office with the Luna orthopedic knee pillow. In men, we recommend the regular size, and for women, we recommend the large to accommodate for the difference in anatomy. We will include a link for this item in the description. In the office, we focus on specific targeted application of Softwave Therapy, which is extracorporeal shockwave therapy, to the tendons at both the origin and the insertion of the glute medius muscle. Treating both the origin and insertion is extremely important. Isometric rehabilitative exercises for the glute medius, specifically targeting modalities and strategic movement patterns to retrain your muscles and restore proper function. If you have been struggling with hip or glute pain that just won't go away, it's time to get this checked out before it turns into a chronic condition or just won't get better. The right diagnosis makes all the difference when it comes to an effective treatment for glute tendinopathy. If you're in the New Braunfels area, come see us at Rose Family Chiropractic Wellness Center and let's get you back to moving pain-free. Also, if you found this helpful, make sure to like, follow, and share this video with someone who might need it. I'll be posting more videos breaking down down common pain conditions and how to fix them, so stay tuned.